It's the time of year that so many people hate. From the blooms and the buds to the dust of yellow pollen on nearly everything. The signs are all there. It is allergy season. Good evening and thank you for joining us tonight at 7:30. I'm Megan Schiller. While the signs of spring are pretty, well, they're not there anymore, but they are pretty, they can be downright miserable for some of us to deal with. But did you know when it comes to allergies, where you live plays a role in your sniffles? Pittsburgh ranked 5th in Asthma and Allergy Foundation of America's list of most challenging cities to live for people with seasonal allergies. The report looked at pollen scores, over-the-counter medicine use, and the number of board-certified allergists practicing in the area. And tonight, we're going to find out why the allergies are so bad here in the Steel City by talking to someone who knows what's going on. Joining us now live on Zoom is Dr. Christine Rauscher, a board-certified immunologist. Thank you for joining me tonight.
Thank you. It's my pleasure.
So you are the director of allergies, so you know what is going on better than the rest of us. What do you think is the magic recipe for allergy season?
I think it's definitely a combination of patients' genetics as well as certain environmental factors. So I think this particular area, and in that report too, they just talk about how our pollen season is lasting longer. And also just with changing CO2 levels in our atmosphere, there can be increased pollen just compared to what we used to have with decreased CO2 levels. So I think there's a combination of different factors going on.
We were talking in the newsroom about if it just seems bad because we're all heading outside for the first time in what feels like more than a year.
I think that's definitely part of it. I think that, there's definitely, a component of anxiety about, runny nose and, sneezing. Could this be COVID? Could this be allergies? And I think that paying attention to your symptoms and talking to your doctor is definitely helpful. And certain things we can talk about in terms of how to prevent certain allergy symptoms, I think are helpful.
Yeah, what are those tips that you pass along to your patients?
So for patients with seasonal allergies, so meaning trees, grasses, weeds, kind of the spring, summer, and fall time allergies, I do recommend keeping the windows closed. Things like when you go inside, taking off your shoes, cleaning off, eyelashes. You can kind of do like a little scrub with some water and some baby shampoo, as well as, changing your clothes, showering, things like that. Also, doing a saline rinse can help. So kind of like a neti pot can help rinse out any allergens or any irritants. All of that can be helpful, as well as other kind of over-the-counter medicines.
Is there a #1 culprit in Pittsburgh for allergies?
So I think it depends on each patient. So some patients will only be sensitized to one of the seasonal allergies. So they may do fine in the springtime, but then when grass rolls around in the summertime, that's kind of when everything flares up. So it's kind of patient specific. I think that we all try our best to help figure out, what might be causing some of the symptoms. And we can do that either by skin testing and blood testing. But if, I more recommend that for my patients who are thinking about wanting to go onto allergy shots, or patients who find that their medications aren't helping. And then that's really what can help us figure that out, because some patients can have other causes, like just irritants and pollutants causing some of their symptoms.
Well, Dr. Rauscher, thank you for your time tonight. And again, if you're concerned, you can always go and get tested to figure out what it is that's irritating you. Thank you.
Thank you.